Well, look, it's a couple of minutes past 1, and we did say we would begin at 1. Thank you all very much for coming to this Centre for Policy Research on Men and Boys webinar, and I'm delighted to welcome two guest speakers, Dr. Claire Wolstenholme and Jozef Sen, on this topic of supporting the mental health of male HE students. Really looking forward to hearing this this talk. So just a little bit about our speakers before we begin, and I hand over to them. So Dr. Claire Wolstenholme is a research fellow in education at Sheffield, Hallam University, with a background in psychology. Her research focuses on mental health, well-being and inclusion in education, and Claire has a particular interest in men's mental health and is committed to exploring how educational environments can better support well-being and engagement for all learners. Our other speaker, Jozef Sen, is head of counselling at the University of Leeds. He is a BACP accredited therapeutic practitioner and clinical lead with over 17 years experience in higher education. He specialises in student, staff and organisational well-being with a focus on clinical leadership, strategic development and service innovation. And Jozef leads multidisciplinary teams, driving the development of targeted interventions and enhancing service visibility across higher education institutions. So we have two experts in this field. Can't wait to hear what you have to say, as I'm sure the rest of us are as well. So I'm going to hand over, I think, to you, Claire, now to drive. Claire will talk for about 40 minutes. Ish, Claire and Jozef, that is, or Claire will talk for 35 and Jozef for 5, however they've decided to do it. About 40 minutes of chat, and then we'll have plenty of time for questions thereafter, and we will be circulating the recording probably next week sometime. So, Claire, over to you.
Thank you. Okay. Right, can everybody see that? I can't see anyone, so hopefully you can.
Yes, yeah, it's showing on my screen. That's all that matters. If it's on my screen, we can see it. Yeah.
Brilliant. And as I say, I can't see you for some reason. So if anyone does want to ask anything at some point, just speak up, because I won't be able to see the chat for a little while. But yeah, thank you so much for having us today. So we're going to talk about male students' experiences in relation to how they understand mental health and being a male student, and then looking at some of the ways that universities and other wellbeing services or communities really can best support males. So thank you for the introduction. I'm a research fellow at Sheffield Hallam University, and my interest in this area came from doing my doctorate exploring male students' perceptions and sort of conceptualizations of mental ill health. And then I had the opportunity to work with Jozef on a couple of projects, so a research project and then an evaluation of an intervention in this area. So Jozef will talk later about kind of what we've learned from our research and evaluation and the implication that that's had on kind of policy and practice. So the quote there on the slide is from the evaluation that we did of a university-based male support group, which was called Talk Club. We're going to talk about that intervention a little bit later. But I'm just going to go through some of our learning in this area, and then, as I say, we'll talk about kind of the implications of it. So why are we focused on male student mental health? So there's been a lot of research, as I'm sure most of you will be aware, in relation to men and their mental health. So we're thinking about their conceptualizations of mental ill health, their sort of symptoms and how they might present in men, the suicide statistic, which I'm sure people are kind of aware of, difficulties with support seeking, stigma, things like that. And at the same time, there's been a lot, especially in the last sort of decade, lots of research and media attention on students' mental health, which the media often kind of calls a crisis. And again, relating to students' susceptibility and the causes for students and how students might be the same or different to the general population, as well as universities having a duty of care to look after their students and what that means to different institutions. But there's less on male students' mental health specifically as a group, and less again on what might work to support male students in this area. So there's been some research done looking at the sort of preferences for support that male students might have, and found that they, they're not a group, they're individuals, but generally there's some preference for sort of peer support, less formal support sometimes, maybe less medicalized. But research also shows that male peers, sort of their friends at university, might not be always equipped with the mental health literacy that they might need in order to support each other in that way. So as I said, I've got this personal interest in this area, and Jozef, who previously worked at the same university as me, was, as a wellbeing practitioner there, was seeing male students attending therapy sessions due to experiencing isolation and loneliness, but also coming at the point of crisis, rather than kind of coming to him earlier on in terms of their feelings. But also noticing that certain demographics of male students weren't using the wellbeing service at all, so we're using it sort of rarely, if at all. So I'll just try in this second. So looking at male students' perceptions then. So the first study I want to talk about was just based on interviews with 16 second-year undergraduate students. And this was trying to understand their kind of views of male student mental health or mental ill health. So participants described the sort of pressure to appear strong or unaffected, this fear of being judged as weak, expectation to just get on with things, and a discomfort in emotional vulnerability. And so on the slide there, that's one of the quotes from one of the students saying, be a man, grow up, you're being like a girl. These phrases that indent into the very core of who you are. So those phrases that they still felt kind of existed. And these sort of gendered norms are still contributing to these difficulties that men can face in recognizing or acknowledging their distress and then seeking support. And then barriers to seeking support were multifaceted. So this was an example. I would go to counselling and talk to somebody about it, but I wouldn't tell a soul that I was doing it. It always felt like a shameful kind of secret to keep to myself for years. So even where there was where they did seek support, it was sort of seen as a sort of shameful thing. And so other barriers were, as I sort of mentioned before, sometimes a lack of mental health literacy, sort of really understanding what it means to have these sort of symptoms or to need support, a lack of awareness sometimes that the support services were there or what they were or who they were for, and then knowing how to articulate those needs, as well as this sort of self-stigma and social stigma. So there was discussion about banter between friends and emotional avoidance, and limited opportunities often for kind of meaningful emotional conversations amongst their peers. And then just an example of a preference. So this person had said maybe making like a space, something male orientated, where it's like a place for guys to talk about their problems, and then saying that hearing other guys talk about how they were feeling helped them to kind of to do the same, really. So gender sensitive provision, normalizing males kind of expressing how they're feeling. And then, sorry, I've got my notes mixed up, just bear with me a second. And the next study that we did was looking at the perception specifically of male students of colour. So this study was based on 28 ethnic minority male participants, and the data was collected through paired conversations of participants with their friends. So it was a listening rooms approach that we used, and this meant that there wasn't a researcher present in the discussions, and instead it was a two friends who kind of had this conversation based on questions that we designed, but they were kind of there alone having this conversation, and then the conversations were recorded. So the barriers that they raised were quite similar to the other study. So lack of awareness of the service, unsure about who or what the service was or who it was for. When I say the service, I mean, the wellbeing service, for example, at the university. And how or when to access it. So this person said, I'd be on a wild goose chase. You just get told there's help, but not how to get it. When you're getting to breaking point, I need to speak to someone. So saying it's that kind of urgency and not really being sure of how to access it when they need it. And then again, similarly to the first study, was this sort of fear of stigma, but it was more intense in this research. So mental health is such a taboo topic in various cultures across the world. I mean, let's take India, for example, where we come from. If you're an undergrad student and if you're going through bouts with depression or some sort of mental health, people expect you to sort yourself out. So for some people in this discussion, it wasn't even a question of getting help. It was just something that they wouldn't even consider. And then more specific to this study was this kind of lack of trust in university-based or sometimes any wellbeing support services, and this sort of perception of a cultural disconnect. So there's further reluctance due to really the belief that the support services weren't kind of culturally aligned with their lived experiences and therefore just couldn't be helpful to them. So again, as you can see on the slide, you have to be relatable back to that person. You can't have a different culture and someone from a different culture, say a white person talking to a brown person about mental health. So that feeling that there was just this cultural disconnect and it just couldn't be helpful to them. And for some, this was linked to feelings of belonging to the institution or lack thereof, which we know is really important as well. So what had we learned at this point? So the university environment, there's still a lot of social expectations and pressures, particularly to men. There's still these kind of masculine norms that they're experiencing. They're still experiencing this stigma, and all this can kind of intersect to create difficulties in understanding mental ill health and then actually being able to do something about it. There's also the fact that support is often sort of culturally coded as being for women or for white individuals, which can be reinforced by the sort of female domination in terms of therapeutic roles in wellbeing services. However, in these studies, these male students did talk about their mental health. So in the first study, they talked to me as a female researcher, sometimes in a lot of detail. They were quite vulnerable, they were quite open, and I didn't ask them many questions about their own mental health, but they were still telling me in detail sometimes about that. And then again, in the second study, with their peer, with their friend, again, they were being quite open in their conversations. So there's, I think there's this perception that men can't talk or they won't talk, but actually I think if the circumstances are right, they're quite keen to talk about this. And also this learning that males often want to be able to talk to their peers, but they felt that they sometimes couldn't talk to their peers. So they've got a sort of preference for relying on friends rather than professionals, but there's this concern over the banter, over the stigma, and over being accepted by your peer group, which is really important to all of us, I think. So how can we better support our male students? So just some of the things that we learnt, and again, Joseph will talk about how to put these more into practice later, but being a bit more proactive, visible and relatable in terms of mental health messages. We know that university mental health services really do try to get the message out about their service, but students aren't always taking those messages in. And so one example that came out from students was about having services signposted by people. So rather than kind of emails or flyers, it's about it being a bit more personalised. And they mentioned lecturing staff, and particularly male lecturing staff, being really sort of positive male role models to signpost to those sort of services. And then the services having staff who are trained specifically on male needs, and different types of male needs, understanding how they might present at the service, how that might be different from females, understanding that they might have different support preferences. So simple things like being able to choose the gender of a practitioner, making sure the access is really easy, and then a bit more deeper in terms of understanding male specific presentations to service and what that might feel like for them. And then enabling peer support. So what do we mean by that? So equipping students to actually better support each other through building up their mental health literacy. And so, for example, we do look after your mates training, which can help, but also setting up peer support groups or networks to help male students support each other. So I'm going to talk about that next. So after we'd done this research, we wanted to look at what can actually help male students support each other in the ways that they're kind of asking for. So just to tell you a little bit about Talk Club. So it's a UK-based mental health charity that some of you may know, and they run peer-supported talking groups led by volunteers, and the volunteers are called captains. And it follows a sort of very structured formula where the captains ask the other participants, the men in the group, starting with themselves, 4 questions based around emotional self-assessment, gratitude, and then sort of forward planning, positive forward planning. And that begins and ends with, how are you out of 10? So using that model, the Talk Club model, Jozef and myself, mainly Jozef, set up a Talk Club at Sheffield Hallam University, where we were both based at the time. And this was for any self-identifying male students to attend. It was a weekly session on campus for an hour, and it used this 4-question model of the Talk Clubs. It was drop-in, so participants could just turn up as and when, and they didn't have to book. And there was up to 12 participants, so there was 3 captains, and if more than 12 were to turn up, they could split off and have smaller groups. So just thinking about the research context and in terms of peer support, so what do we know and what don't we know? So we know that peer support can offer men socialization opportunities and relationship building, which can improve psychological health through, for example, reducing isolation and loneliness. There's evidence that experiential similarity can support men in normalizing their feelings and reducing the stigma. So just hearing other men talk about their experiences and their behaviors and their feelings can really help men to see a similarity in their own experiences and behaviors and feelings. Male-only groups can be really helpful to provide a sort of feeling of psychological safety to people who attend. And then the accessibility is quite important. So, as I said, the one that we set up was for men who attend the university, and the captains, the peer supporters, are male students themselves. So they're the same as everyone else in the group. So there's no hierarchy, and there's no power dynamics that you might have with a therapist, and there's no kind of medicalized language there. And then you've got the sort of group dynamics of kind of listening and helping each other, which can be kind of quite powerful, thinking about kind of problem solving for each other. So that's a very quick snapshot of what we do know, but there's less evidence in terms of how this works for male students, again, as a sort of specific peer support group, and even less, if any, on the impact on the peer supporters themselves. So this is what we decided to do, was to look at the impacts on the the captains, who were the peer supporters, who were male students themselves. And so they were kind of engaged participants. They were sharing their experiences and benefiting from the group support through their participation. And the captains would sort of model openness and vulnerability and connection, which is really important to the sort of ethos of this intervention. And they had this dual identity. So they were kind of balancing their supportive role with their own personal participation in the groups, which was one of the things we looked at in the study. And the research questions are there on the slides. They're really straightforward. We just wanted to know what the impacts were and what might have enabled those impacts. So we recruited 3 captains, as I said, from the university male student population, who were going to act as these peer facilitators. And then they were supported in their role by Jozef, who was the lead wellbeing practitioner at the university, and he oversaw the training and acted as a sort of mentor and a supervisor for the captains. So this, I'll not go through in detail, but this is kind of answering the research questions. So the impacts on captains were sort of split into improved psychological well-being and skills acquisition, and then some of the enabling factors was the training and the support from the lead wellbeing practitioner, the format of the talk club, so what I talked about before, this sort of 4-question format, this focus on gratitude and growth. And then lastly, the lived experiences of the captains and the importance of that. So I'm going to go through some of these, but not all of them. So what was really important was the impacts on the captain's psychological well-being. And so we talked before about this reduction in isolation and loneliness. So I'm going to read the quote. So I spent last Monday in bed just for one reason or another. This is a captain. And I came into the room at 4:30, and you get like just a buzz that you're just being around people. We're in a place of test, like my own ability to share my emotions. I've never been in a situation with guys talking like this before in my life. It's just happening on a weekly basis. We just sit and share the deepest things going on in our heads. So these were the words of the captains. And so this reduction in isolation and loneliness was sort of threefold, because it was a kind of obvious meeting new people and building this community, but also kind of providing that routine and that guaranteed social interaction on that day, that consistent guarantee of social interaction. And then also, as I'd said, sort of reducing the isolation and loneliness that can come from thinking that you're alone in terms of your experiences or your negative thoughts or emotions or even behaviours. And again, looking at still the psychological well-being improvements, so improvements in relationship. So I've been more comfortable talking to my friends. I've made more friends outside of this. Just my life has improved a lot since taking this over. That's the difference in the past 6 months. I know my friends in a completely different way, and that's because of the talk club, without a doubt, because it took those conversations I was having in counselling out into the public, and then it just made it feel like, okay, it's not that scary now to just be myself. So they described how their existing relationships had improved through their ability to be authentic after sort of testing out their capacity to share their feelings and emotions with their peers in the talk club setting, and seeing what happened there and seeing that was seen as okay, and sort of validating that. So they were able then to do that with their friends, but also being more confident in interactions and making new friends and just feeling that they could be authentic. And then still on the psychological well-being was this kind of redefining and widening notions of masculinity. So I find that most of the time I've spoken to men, it's usually about football or whatever. But like recently, I think one of the main topics of conversation is that we talk about Doctor Who a lot. It's one of the things I would really talk to men about. It's kind of embarrassing. And then it's like surprising how common it is with other people, but it's almost like a taboo. So the captains gave a few examples here where they had these interests that felt that they were not sort of considered manly enough to discuss with other men, and therefore they had to sort of keep those quiet when they were talking with their peers. But they'd felt that they'd had this sort of, again, experience of validation of these interests that were considered non-traditionally masculine. I don't really know about Doctor Who specifically, but through those honest conversations that took place within the talk club space, sometimes more informally after the talk club, where they would just chat with the guys who turned up there and have these sorts of conversations. I'm probably just going to skip over this one just because of time, but skills acquisition, so learning about kind of psychological nudging and signposting, and also they talked about how this had been a really great piece of work experience for them and affected their future careers. And then some of the enabling factors. So I think I'd said it was really important that they'd had this training package, and the support from Jozef was really important for their role clarity, for them setting up boundaries, feeling psychologically safe, and just having Jozef there as a safe place to talk about any difficulties that did come up within the talk club. And then the format of the talk club was really important. So again, having this kind of prescriptive script to go on made it feel safe. Having the sort of talk and listen format, having the 4 questions that focus on gratitude and growth being really important. And one of the captains was talking about mental strength and a check-in, and kind of having these conversations before you get to the point of crisis was really important. And then the captain's personal experiences, so using that was really important. So for me, the best thing is when people go, oh, I feel the same way about that, because I think people can often feel really isolated in their own head or how they feel. So when they come to talk club, they can just realize they're not on their own and other people are feeling the same. And I think that can be quite powerful sometimes. So we've talked about this, but just that's kind of where the sort of experiential similarity comes into it, and really feeling the power of that within the space. So they were using their own previous mental health experience of actually getting formal support to sort of model vulnerability to other men, so that other men felt that they could do the same. And I'm going to hand over to Jozef to just talk about some of the implications of our research and what we already did at our university and what Jozef might be doing at Leeds now, and also kind of wider than just university. Jozef, do you want me to come out of the slides?
So I'm happy for you to stay in them. Okay. If you want, Claire, just to keep it on there as kind of a talking point.
No,
thank you for that, for doing all the heavy lifting around this. I thoroughly appreciate it. I may not even need 5 minutes as we go, but I'll come into my own at the questions. I think what for me really stands out in this constellation of work, this kind of tapestry that Claire has talked us through, is the collaboration between researcher and practitioners. And how in large complex organizations like universities, we can do an awful lot of kind of knowledge creation, knowledge formation, but sometimes that sits in a research only silo. What we were able to do was really come together with a shared interest and in positions of influence where we could start bringing some of these research topics, these ideas and these themes, and put them into life and into practice, kind of out there in the institution and embedded within it. I think one of the key findings in this is not only the researcher practitioner element, but where we were quite fortunate, and I think where this work has been incredibly impactful, is in my position as practitioner leader. So I have been in positions where I'm able to influence, to make decisions, to design and kind of rubber stamp interventions if they are clinically sound, robust, and well positioned. In large organizations like universities, but it happens in all organizations, you can often get pockets of practice that start to develop that people kind of do in goodwill. They just kind of go about their own business and set it up. There's not necessarily a cohesive or coordinated element to it. And I think what we were able to do, as I say, through this constellation of research was really bring together a cohesive, coordinated suite of interventions, ideas. People knew we were doing it. We acted as an anchor point for other bits of practice that were taking place within the university. And I think that was one of the really kind of strong elements to this from my experience. all of the findings that Claire's talked kind of through from the different research pockets were clearly pointing to friendships, peers, less formal interventions, early intervention, as being kind of the key elements to male students seeking support. Now, what we were really keen to do was to support this kind of peer support element that Claire's talked about with the talk club, but actually not to place the onus on peer supporters in isolation or in separateness from the institution. One of the core kind of elements, I think, of the work we've done is making sure that the peer supporters were themselves held, supported, and supervised appropriately. So we had a level of clinical oversight, robustness, and governance, even to the peer support networks. I think we can often bring in elements, and we almost just think it's an easy cost-effective option to move towards peer support. And actually, I think that's where a lot of peer support might fall down in institutions like universities. We really did benefit in this instance from having that clinical connection to the delivery and to the peer supporters themselves doing the actual delivery. Now, it was unobtrusive and it was almost invisible to the male students who attended the talk club. But importantly and crucially, the peer supporters knew they were held within that clinical supportive framework. And I think it empowered them and kind of strengthened them in the work that they were doing. And I think that kind of came out in the research findings. I'm trying to think what else I was looking at. One of the key elements, again, as I say, was creating credible pockets of kind of male student leaders. It's one thing, somebody like me going up there or an academic, but actually investing in the training, in the development of these peer supporters was one of the kind of cornerstones, the keystones to this whole suite of training that we did. Just going to take a quick look at my notes and say, yeah, consistent trusted messaging from student-facing staff, little but often. I think one of also the other thing to note here when we're looking at practitioner leadership elements and how we're feeding into decision making within institutions is the opportunity to invite consideration to male student peer support, male student support and mental health support within our access and participation plan reviews and activities that we're doing. Really helping to make sure that we consider gender, racialization and other identity-based disparities and working to ensure that there's institutional strategy which actively supports the underrepresented masculinities and promotes inclusive well-being. We did find out from a lot of our research that male students, and particularly ethnically minoritized male students, would often present at points of crisis, of points of quite emotive charge for them, really. And unfortunately, at times, what we notice, I've noticed it for years in practice, and this research really illuminated it, is that would often create quite a reactive response from universities, from support services. We would often, or services would often almost over pathologize that presentation and not considering it as a normal kind of part of kind of masculine presentations at that point. We were able to develop something within the university at Sheffield, Hallam, whilst I was there, called the International Students in Distress pathway, which was in acknowledgement of this recognition that at the point of presentation, usually there's been the straw that broke the camel's back. Some of the language might be quite emotive, some of the emotional charge is quite high in the room, and there was often a bit of a scattergun approach, students not necessarily knowing who could help them, who would help them, sending out emails or phone calls kind of across the board. So what we were able to do was to identify those themes and those patterns, name them, and understand them as part of quite a normal presentation. Oh, somebody liked that work there.
Is that you shouting out, Deb?
Debbie?
I think someone's not got their mute on.
Sounds exciting, whatever's happening there, Debbie. Sorry, I've lost my train of thought. We created the International Students in Distress kind of pathway where we came together as a coordinated group of people saying, this is what's happening, this is what's presented. We don't need to over pathologize this. We don't need to over intervene. Let's have a clear, coordinated and concise response, where we can manage the emotional charge that is taking place here and see this a little bit more clearly for what it is and what it might be. One of the other things that I think was incredibly powerful in the work we've done at Sheffield Hallam is, and we'll be seeing this again in live time with the manosphere work and conversations that are taking place, we didn't lean into pushing against, fighting or conflicting with the toxic masculinity kind of narratives. We created pockets and shone a light on other areas where empathy, listening, cohesiveness, togetherness kind of shone through. And it wasn't to act in opposition to these other pockets of masculinities that were taking place or these other thematic trends that were occurring. We didn't get into the wrestling match that can sometimes arrive from kind of those kind of tensions. We created well-supported peer supporters with credible kind of positions within the university, and almost the gentleness of that spoke for itself and started to compensate for some of the other kind of masculinities and toxicities that were particularly rife at that time. I think that's probably my little bit done. Claire, unless there's another nudge you want to give me if I've missed anything off. Oh, the other thing I wanted to mention, sorry, is particularly pertinent within universities. We had several talk clubs within Sheffield at the time that we set up our talk club. What we do know about the student population, and this isn't just the male student population, but it's general, is they will not go outside of the university for their support. It's very difficult to get students to NHS services. And as I say, we had a talk club at the time at Sheffield United Football Ground, which is about a 10-minute walk from Sheffield Hallam University. Not once did our students go there. I think I saw one that I heard of. Once we created it at Sheffield Hallam, again, they saw their likeness, they saw experiential sameness and similarities. And they really started to access it when we brought it in-house. So this isn't necessarily about signposting well, this already exists out there. It's about really listening to the population and the communities that we're serving and making sure that we are facilitating something within the kind of systems of our universities and our spaces. Now I am done.
Yeah, I just want to just add one thing. I think it's that personalization approach, which I think you were talking about there. I mean, there's just been some research people might have seen come from TASO about how the nudging doesn't work in terms of sort of checking on students, and it's kind of deeply impersonal. And so, you know, what they want is to be told by a human, and you know, it's very difficult, resources are low, but even just a short you know, this service is available, I'm your lecturer already, maybe I'm male, and just want you to know it's for everyone, it's for you. I might have used it myself, just those kind of and I see somebody has put in the chat about not having those safe spaces for this specific group, and I think that's really key, is that men can feel left behind, you know, and the male students who I was speaking to were 18, 19, saying, I feel like I've had my say, I'm not allowed a say now because I'm a white male and we're the most privileged group in society, so we have to be fine, we can't need support. So actually, if you do need support, it feels like you've really failed because you're supposed to be, and I think it's really important that we don't kind of leave this group behind with these feelings that, you know, they're young, they're just coming into the world really, and already being sort of told you've had your say already now. But yeah, so that's it. Thank you.
Brilliant, thank you for that. Claire, could you stop sharing just so that
you
can see the many hands that will undoubtedly be going up.
Okay.
That was fascinating and really rich, actually, and some really sort of strong themes coming through. So thank you for that. Now